Talk about a really interesting muscle. Well, I think it's interesting, and it's called palmaris longus. Palmaris longus is a muscle which starts at the inside of the elbow, just here, and runs down the centre of the forearm, and it attaches onto a structure I've talked about in a previous video called the flexor retinaculum, and it's continuous then with a layer of fascia called the palmar aponeurosis. Okay, and that palmar aponeurosis is basically a layer of fibrous, tough tissue which helps with moving the fingers and keeps the skin nice and resistant to injury on the palm of the hand. If you get a problem with this fascia, you can develop Dupuytren's disease, which again I've mentioned in a previous video, and I've got a little bit of Dupuytren's disease developing here. It looks like a nodule in the palm of the hand, and you can get pitting and curling of the fingers. Interestingly, it's more common in rock climbers. Okay, now the reason for this video is that I want to ask you two questions really, well, three questions in fact. Do you have the muscle present? Interestingly, it's absent in about 14% of the population. Some people have it on one side, some people have it on both sides, some people just don't have it at all. So we'll check whether you've got it. The second thing I want to ask is what level you climb at, so what grade you can climb. Now, I'm interested to know whether palmaris longus allows people to climb a little bit harder, particularly because I think it may have a role in pulling on sloping holds, slopers. Okay, so let me know. Comment underneath this video, are you good on slopers and have you got the tendon? The third thing that interests me is whether or not the presence of this tendon, palmaris longus, has any relationship to the development of this disease called Dupuytren's disease. So the third thing to tell me is, do you have Dupuytren's disease? Okay, so do you have the muscle? What grade can you climb at? Do you have Dupuytren's disease? You can check your palm for nodules and lumps and bumps and tenderness. And let me know whether you've got that. So, how do you check if you've got the muscle? So bring your thumb and little finger together, okay, and then just lift your hand up. It's easier if I move the screen at this point, I think. So you've got the fingers, the finger and the thumb together, like so. Now just lift the wrist up, and you can already see on me that I have this tendon that really sticks out. Hopefully that's obvious, okay. Yeah, so that is the palmaris longus tendon. And it's right in the centre of the forearm, runs up to the elbow. Okay, and you can see it pops up and down when I do that. So it's relatively easy to check if you've got that. If you're not sure, what you can also do is just push on the finger and thumb, and just push in the direction of the index finger, so kind of push towards there, and you can see it brings it out even more obviously on my wrist. So that's the palmaris longus test. So have a go. Let me know, have you got the palmaris longus tendon? What grade can you climb at? Maybe it's helpful, maybe it's not. And do you have Dupuytren's disease? Maybe it's related to that, maybe it's not. I'm interested to know. And the last thing I wanted to say to you is that some will say that people who don't have the palmaris longus tendon are a little bit more evolved than people that do have it. So apparently I'm a little bit primitive. So yep, interested to hear your thoughts. Thanks for watching, and watch the other videos to learn some techniques to help reduce your injuries that you pick up while climbing. Okay, so thanks for watching.